Okay, so ovulation is very important to help us understand our reproductive system. So in general, if you know that in general, every woman has a cycle of 28 to 30 days or maybe 26 days. Okay, so I'm Dr. Shweta Rajesh, obstetrician and gynecologist, and I also practice infertility at my hospital.
Right.
And I've been using this Andro wash since 2 months.
Oh, you're using Andro wash?
Yeah, I am using it.
What is your feedback?
Feedback, it is fine. It is quite practical and easy to use.
Have you had any success?
It is beneficial. Yeah.
That's awesome. Well, as a start, the way we understand it, every woman has got different types of menstrual cycle. Now, everywhere in internet, people talk about only the standard 28 to 30 days wala menstrual cycle and how to track ovulation. Yes. But I know for a fact that some women get menstruation after 45 days also. So please understand, please help us understand how to calculate ovulation. And before that, what ovulation is all about.
So first you need to know why we want to understand ovulation. Okay. Yes. So ovulation is a process during which in every cycle, one of the ovum gets matured and it gets released in our reproductive system. And if when the ovulation occurs, and if at the same time we have intercourse, the sperm enters, and because of the fertilization of ovum and sperm, pregnancy happens. So if you want to get pregnant, even for that, you should have the knowledge of ovulation. And if you want to avoid pregnancy without using any medicine, again, the same thing is there. You need to understand ovulation. Okay. So ovulation is very important to help us understand our reproductive system. So in general, if you know that in general, every woman has a cycle of 28 to 30 days or maybe 26 days. Okay. So we will know, okay, if somebody has a cycle of 28 days, so on the 14th day, she is ovulating. And if because what happens, the day you ovulate, exactly after 14 days, you will get your periods. If you're not getting period, that is. Okay. So you can very well calculate your ovulation backwards. Retrograde. Understood? Yes. So if suppose, okay, so we will know, okay, if somebody has a cycle of 28 days, so on the 14th day, she is ovulating. And if because what happens, the day you ovulate, exactly after 14 days, you will get your periods. If you're not getting period, that is. Okay. So you can very well calculate your ovulation backwards. Retrograde. Understood? Yes. So if suppose somebody has a regular cycle of 45 days, every month she gets period after 45 days. So if she gets her period on 23rd of August, so we can know that next period will come after 45 days. So that will be approximately 30 plus 8, 38 plus 5, 6, 7. So 7th of October. Actually, it will happen like that. Okay, after 45 days, that will be 7th of October. So we take it. We consider 7th of the October is the next period date. So backward we can come from 7th of October to backward we will come. So ovulation date will be on 23rd of September. Okay. Understood? So if like for 2-3 cycles, if some patient want to calculate it, and they will know, okay, exact 45th day I'm getting my period. So they can track their ovulation, but it is never on the exact date.
Yes.
Okay. So if you want to get pregnant, you have to consider 4-5 days extra. Like if we are taking 7th of September is going to be my ovulation date. So I want to get pregnant. So I should make sure that around 7th, or on 23rd, I have to meet with my partner so that I'll get pregnant. And if I don't want to get pregnant, around that time, I will avoid meeting. So this is the funda.
A lot of maths is involved, a lot of calculation. The best thing is for a woman to track her period menstruation time for a few months if she's planning a pregnancy.
Yes.
And then she can always calculate backwards.
Yeah.
Yeah. But how true
other than that also. Yeah.
Yes, please go on, ma'am.
No, other than that also, we have some ovulation kits in the market.
Yes.
Okay, so with that also, you can track your ovulation.
How do you track the ovulation with the ovulation kit?
Again, see, the ovulation kit has 5 strips. Okay, so you suspect that around this time I am going to ovulate. Exact date nobody can calculate. So around those time you have to. It is just like a urine pregnancy test.
Sure.
You have to take a few drops of urine. You have to put on the kit. So the day you ovulate, that kit will show positive result.
Okay.
So like that, you will know the exact date of your ovulation.
And this is predictable, right? The ovulation kit.
Yes.
Okay. So if I am trying to get pregnant and I'm not sure of the exact date of my ovulation, then I can go and purchase an ovulation kit and use it.
Yeah.
And that'll help. How far is it true that you only can get pregnant once in a month? I was of the opinion that you can get pregnant like a few days in a month. There's a window.
Yeah, there is a window. What happens that when you have intercourse, the sperm gets deposited in our vagina and uterus. Okay, so the number of sperm gets increasing every day. So if not on the day of ovulation, by chance you have missed tracking your ovulation, you miscalculated your ovulation, you thought that your ovulation is going to happen today, but it did not happen today, it happened next day. But you had intercourse today, so the sperm is alive in your uterus for 72 hours. So even then you can get pregnant.
I see. So it's very easy to use, right? The ovulation kit. You just...
Yeah, it is very easy because you have to use urine. Like we do a urine pregnancy test, that home kit is there. On that we put few drops of urine. The same, the ovulation kit also, you have to put urine on that. So if ovulation has happened, it will show positive. It has not happened, it will show negative.
So just for information, there are some women very young as 21, 22, who do not ovulate. So for them, the strip will not work.
Unless you are ovulating, it will not. And you can't get pregnant if you're not ovulating. You will never get pregnant.
Yes.
Ovulation is a must for a female to get pregnant. The first and foremost.
So the day of the ovulation is when your egg drops.
Yeah.
And 1 or 2 before the date of the ovulation, and maybe 1 or 2 days after the ovulation is when you have got a window.
Yes.
Ma'am, when, for example, I am of the right age and I want to get pregnant, I am tracking my ovulation date. And for some reason, I have to use a home insemination kit. So can I track my ovulation date at home and use the home insemination kit successfully?
I can't assure you about the success, but yeah, definitely you can, because there are some signs of ovulation as well. Many females, they get pain when they ovulate. They get pain, so they know that it is ovulatory pain. Not everyone, but a lot of females, they will tell you that during mid-cycle, I get pain for 1 day. Pain in stomach.
Apart from using a ovulation kit, what are the ways of tracking ovulation?
What are the ways? There are various ways. One thing is you do maths calculating. Okay. That is like in general. The other thing is, you must have seen that there are some discharges in vagina throughout your cycle. So the quality of discharge keeps changing.
Yes.
Okay, sometimes it is thick, sometimes it is watery, and sometimes it is sticky. So during ovulation, if you will put it in your finger, it will like be sticky like this. Like a thread will form like this.
Okay.
So that is one of the signs.
That's like one of the best signs?
One of the best signs. It is called a traditional tracking of ovulation.
Okay.
Like during olden times, females used to track like that.
Oh.
Yeah.
That's nice. That's good information to know.
I have had few patients, 2 patients actually. They said that they have tracked their ovulation with this quality of discharge, and they have never got pregnant by mistake.
Wow. That's amazing.
Because they contained themselves during those times. the home methods I've told you. Another way is the ovulation kit you get in the market.
Yes.
And the most confirmed way is ultrasound. That is 100%.
Achha.
Like you are sure because you can see it happening. You have to track like around day 10. We call the patient and we do the ultrasound and we see what are the size of the egg and how it is going, how many eggs are growing. Because in some patients, when we give them medicines for ovulation, 2 or 3 eggs can start getting matured.
Yes.
So we start on day 10, we do it on alternate day. And when the egg is of the adequate size, we start seeing that there are chances of ovulation. So we call them the next day. And next day we will see the eggs have disappeared and there will be fluid in POD, pouch of Douglas. So with that, we are sure that ovulation has occurred.
So, so the pregnancy happens on the day of the ovulation, right?
No, it doesn't happen like that. It is like the fertilization happens. Okay. If like we are sure today the ovulation has happened and the partners have met. So the egg has reached the uterus, even the sperm has reached the uterus. And after that, the process of fertilization happens.
Okay.
So you cannot be 100% sure that fertilization has happened. If fertilization happens, then implantation happens in the uterus. And all these process will take 15 days. So after 15 days, when you were supposed to get your periods, you will not get your periods.
Yes.
And then you will get to know that, yes, you are pregnant.
Okay. So for my knowledge, the ovulation date is the day the egg is released. And that's after that is when the fertilization and implantation happen, not before that.
Yes. Not before that.
Okay. So
because ovulation will happen in every woman, but not every woman will have sex and get pregnant in the same cycle.
Right. So I think the most interesting takeaway is one, women have got different ovulation date according to the menstrual cycle. So a woman trying to get pregnant must know their body and must also track their menstruation time. Secondly, you can use ovulation tracker kit, which are available in the market. It comes in a strip of 5, and you can use, you can pee on the stick and then that'll show you your ovulation date. Or you can also check your cervical mucus and your body temperature. Some women, like you said, get abnormal pain. So these are the ways of testing. The sure way of knowing that you're ovulating is when you do an ultrasound. That's perfect.
Yes.
That's perfect. Yes. Well, ma'am, thank you so much for your gracious time. And I'm so glad for your feedback for the Androwash machine. Well, Subhak Health Tech wishes you the very best, and we thank you for your time. And we will talk another time. Thank you so much.
Thank you.
All right. Bye-bye.
Bye.